Hey there, is dental coverage covered under Original Medicare? Let's talk about it. It is not, with some exceptions. Original Medicare does not pay for dental cleanings. It doesn't pay for, x-rays and things like that. The exception would be if you had an emergency, maybe you broke your jaw in an accident and they have to fix it, so they would take care of that. If you had maybe to have some teeth removed because you're having surgery, they would take care of those kind of things. It would have to be medically necessary for them to pay for them. How do you get dental coverage when you have just Original Medicare and a Medicare supplement, also known as a Medigap? You would have to purchase a separate dental policy, and your agent most likely will be able to help you purchase that. Or I tell my agents and my clients to go talk to your dentist and see what kind of policies they offer. A lot of dentists have their own in-house policies, or if you go to some of these bigger franchise dentists like Greenberg Dentist, or I think there's a few of them out there, I don't know all the names of them, but they most of the time have their own plans also. Now, what about if you're on a Medicare Advantage plan, also known as a Part C? Is dental covered? Very limited coverage, right? You're going to get cleanings, you're going to get fillings, you're going to get, a couple of extractions depending on the policy and the carrier, maybe 1 or 2 per year. And so what I tell people, because it's very limited, you're not going to go in and get your whole mouth done. There's a few carriers out there that will pay for dentures, and they'll pay for the removal of the upper and the lower and then help you with the dentures. But that's limited. I mean, that's not the norm. There's not a lot of carriers that do that. There's certain carriers across the country that do. And then, so just call your carrier and ask them if they do. But I tell my clients, exhaust your benefits on your Part C, also known as a Medicare Advantage plan. They're dental first. And if you need more dental, go buy a standalone plan. Here's the problem I have with standalone plans. Some of those standalone plans are limited coverage for the first 6 months or to almost a year, because they don't want you to come in, get a root canal, get a bunch of work done in your mouth, and then drop their plan. So they force you to pay for it for a year. I'm not a big fan of dental insurance. I know it's important, but I don't sell dental insurance. I'm not a big fan of it. I really encourage my clients to go talk to their dentist and see what kind of programs they offer, because a lot of them can do in-house programs. It's been very rare for me to have a client come back and say my dentist doesn't do that. So I strongly suggest that you do that. If not, because there are some out there that don't, you have options to go online and find people like Cigna, find people like Delta Dental, Aetna, Mutual of Omaha. All these companies, most like Humana, they all usually carry a dental program that you can purchase if you're on Original Medicare with a Medicare supplement, and if you need extra dental after you exhausted your Part C, also known as a Medicare Advantage plan, the dental that is built into your plan. All right. Now, if you guys have any questions about Original Medicare, Medicare supplements, also known as a Medigap, Medicare Advantage plans, also known as Part C, and dental coverage, let me know and I'll answer them for you. You guys have a great day.